Shortness of breath or dyspnea can be a result of various conditions. Some of these conditions involve the lungs, others the heart, and some are caused by metabolic, toxic, neurological, or endocrine factors. The key is to monitor the patient, ensure oxygen supply, establish intravenous access, and follow the ABCs of emergency medicine: airway, breathing, and circulation. In severe cases, intubation might be necessary to protect the patient's airway. Let's start with the pulmonary causes. Airway obstruction can lead to shortness of breath. Diagnosis can be done through imaging tests, such as X-rays or CT scans or a bronchoscopy. Treatment options include corticosteroids to reduce inflammation and, in severe cases, surgical interventions such as tracheotomy or airway reconstruction. Next up, we have respiratory failure. This can be classified into type 1, with a partial pressure of oxygen less than 50 millimeters of mercury, and type 2, with a carbon dioxide level above 60. Treatment generally involves oxygen therapy, which can range from nasal to intubation, depending on the patient's oxygen level and breathing ability. Anaphylaxis, a severe allergic reaction, can also cause shortness of breath. This is treated with epinephrine, early intubation, aggressive fluid resuscitation, and beta-2 agonists to deal with bronchospasm. Pulmonary embolism is another potential cause. It presents with shortness of breath and pleuritic pain. Diagnosis involves the use of Wells criteria, Perk criteria, ECG, D-dimer, and chest CT. Treatment usually involves anticoagulants and, in severe cases, tissue plasminogen activator. Tension pneumothorax, usually resulting from trauma or smoking, can also lead to shortness of breath. It is diagnosed with a chest X-ray and ultrasound, and treated with needle thoracostomy and chest tube. Moving on to cardiac causes, myocardial infarction is a major culprit. Diagnosis involves an ECG and cardiac enzyme tests. Treatment includes pain control, antiplatelet therapy, antithrombotic therapy, and in some cases, primary percutaneous coronary intervention or fibrinolytics. Pulmonary edema is another cardiac cause of shortness of breath. It presents with hemoptysis, a tight chest, and a suffocating feeling. Diagnosis is usually made through a chest X-ray, and treatment involves diuretics and oxygen therapy. Congestive heart failure presents with left-sided symptoms like shortness of breath, fatigue, orthopnea, angina, and right-sided symptoms such as abdominal distension and leg swelling. The primary lab test for this is the B-type natriuretic peptide, or BNP, but chest X-rays, ECGs, and ultrasounds can also be useful. Treatment includes oxygen therapy, intravenous access, and medications like furosemide and nitroglycerin. Moving on to toxic causes, we find organophosphate and carbon monoxide poisoning and sepsis. Sepsis is diagnosed using the Systemic Inflammatory Response Syndrome, or SIRS criteria. Treatment includes early antibiotics, ringer lactate, and vasopressors. Metabolic causes include different types of acidosis, diagnosed with arterial blood gas and anion gap tests. Treatments can range from sodium citrate to insulin, depending on the specific cause. In the endocrine system, thyrotoxicosis can cause shortness of breath, along with symptoms like weight loss, irregular heartbeat, and heat sensitivity. Diagnosis involves thyroid function tests, and treatment can include antithyroid drugs, beta blockers, or even thyroidectomy. Finally, in the neurological realm, Guillain-Barré syndrome and amyotrophic lateral sclerosis, or ALS, can cause shortness of breath. Guillain-Barré starts with tingling and weakness and can progress to complete paralysis. Diagnosis involves neurological examinations, and treatment focuses on removing antibodies from the blood. ALS, a fatal motor neuron disease, is diagnosed with neurological examinations, EMG, nerve conduction studies, and brain MRIs. While there's no cure, treatments aim to slow progression and manage symptoms. Multiple sclerosis, or MS, as it is commonly known, stands as a complex puzzle affecting millions of people around the world. Multiple sclerosis is a long-lasting, chronic disease of the central nervous system, which includes the brain and spinal cord. Imagine the nervous system as an intricate network of electrical wires transmitting signals back and forth from the brain to every part of the body. Now imagine if the insulation covering these wires starts to wear off. That's essentially what happens in MS. The body's immune system mistakenly starts attacking the protective covering of nerve fibers, known as myelin, causing communication problems between the brain and the rest of the body. The symptoms of multiple sclerosis can vary widely depending on the amount of nerve damage and which nerves are affected. Some people may lose the ability to walk unassisted, while others may experience long periods of remission without any new symptoms. Problems with vision, arm or leg movement, sensation or balance are commonly associated with this condition. Fatigue, dizziness, and difficulties with coordination and speech are also frequent complaints. Diagnosing multiple sclerosis is a challenge. There's no single test that can definitively identify it. Typically, a diagnosis is made based on a combination of factors. This includes a careful review of medical history, a neurological exam, and various tests such as blood tests, spinal fluid analysis, and MRI scans. An MRI scan of the brain performed with contrast can show a typical MS pattern, and combined with a history of a single attack, this can be enough to diagnose it. Unfortunately, there is no known cure for multiple sclerosis. The focus of treatment is on managing symptoms and improving the quality of life for those affected. This often involves medications for pain relief and steroids to manage relapses. Physiotherapy, occupational therapy, and other rehabilitation programs also play a crucial role in helping people with MS maintain their independence and functionality.